With the financing provisions of the ACA and the individual mandate and insurance expansion, states that beginning in 2014, all Americans must carry health insurance or pay a penalty or some kind of tax, except for individuals with certain requirements, including the incarcerated. So what do people who are incarcerated do for health care? Depending on the state, health care in prisons vary across the board. At best, it's about as good as a low-income health plan. At worst, it's almost non-existent. Since there are multiple correctional health systems depending on state, the population served by each system differs mildly. One of the biggest correctional healthcare systems in the United States is the National Commission on Correctional Health Care, or the NCCHC. Individuals in jails, prisons, and juvenile confinement facilities are the beneficiaries under this system. Most people find themselves in these facilities are individuals whom are charged with or convicted of certain crimes of their state or the nation.
Until the 1970s, the public did not acknowledge the care and treatment of inmates. Until this time, almost all jails and prisons had no health care service to provide for inmates. This issue was brought into focus by different health organizations and the courts. They were able to set up guidelines for what the healthcare system should consist of. Some facilities cooperated with these guidelines, but others were forced by the courts to provide health care services to the incarcerated. The AMA became involved with the improvement of health care services in correctional facilities throughout the United States. They performed a study through a questionnaire sent to different jails and prisons. They found that 65.5% of jails only had first aid available to inmates, which they considered a medical facility. AMA also found that 28% of the facilities had no physicians available on a daily basis. This study, along with inmates' testimonies about their little access to health care, made the public realize the need for better healthcare systems within the correctional facility. Many citizens believed it was just good public policy to provide better health care to those who had no power otherwise. Ethical, health concerns, security, and legal issues were also catalysts for improved health care. According to a social standpoint, ethical concerns were the largest reason to improve these issues. Most people believe that health care should be a right to all individuals, not just those who could pay for it. Correctional organizations also showed their support. The National Sheriff's Association released a statement showing their support. They believed it was the institution's administrator's job to not only secure all inmates, but to care for them as well. There was also support from American Correctional Association and U.S. Bureau of Prisons.
Before the correctional health care came to be, the court system had a hands-off policy when it came to the inmates' health. The inmates basically had no rights, and with the exception of the 8th Amendment's general prohibition against cruel and unusual punishment, nothing in the U.S. Constitution applies directly to the protection of the inmates. The courts interpreted the realm of correctional administration as beyond their jurisdiction to review. Then, during the 1970s, federal courts decided that they would intervene with matters of internal administration of the facilities. They ruled that at least certain basic elements of adequate health care must be provided. The case that brought about the end of the hands-off policy regarding the inmates' right to medical care was the Newman v. Alabama case in 1972. In this October 1972 decision, a U.S. District Court found the entire state correctional system of Alabama to be in violation of the 8th and 14th Amendment rights of its inmates by failing to provide them with adequate and sufficient medical care. After the Newman case, many new cases followed about inmates' rights, and courts ruled in favor of the inmates. The court's rulings gave certain inmates in certain areas the rights, but not all the cases were federal court decisions, so not all the rulings applied equally to all inmates. Since the 1970s, there has been an improvement in specific correctional health care facilities and attempts to alleviate certain medical conditions.
The ACA's new implementation of the individual mandate brings a lot of new questions regarding correctional facilities and those that are incarcerated. In loose terms, the ACA requires all those who do not obtain health insurance to pay a fee in the form of a tax. However, because the people that are incarcerated are not eligible to purchase insurance from the marketplace, they are not held liable to paying the fee. Therefore, Medicaid, Medicare, and even private insurance cannot be utilized when the person is incarcerated. Naturally, this has invoked a lot of questions regarding the economic factors involved in healthcare for correctional systems. Maria Schiff, the director of Pew State Healthcare Spending Project, provides information to policymakers in hopes of understanding healthcare expenditure while also improving America's health. She states, nationwide prison healthcare spending totaled $7.7 billion in 2011, down from a high of $8.2 billion in 2009 after adjusting for inflation. The downturn in spending stemmed in part of a reduction in state prison populations. While states have had some recent success in lowering costs for healthcare and correctional facilities, new problems are arising. Much like the general public, there is an aging inmate population. There is also an increasing prevalence of infectious and chronic diseases, mental illness, and substance abuse among inmates. All these factors contribute to a steady increase in spending that is difficult to slow down because of quality regulations. In fact, while Medicaid has risen to become the largest component of the state's healthcare spending, correctional healthcare has managed to stay in close second over the last 2 decades. Although there has been very little action taken recently to help improve cost spending, there are strategies that are being evaluated. The Pew Charitable Trust has identified 4 innovations that may help keep down state spending as well as improve quality and access for inmates. The first is employing telehealth technologies to facilitate inmates' access to care and reduce guarding and transportation costs. The second involves outsourcing agreements that ensure the quality of care and control costs. The third advancement would enroll eligible inmates in Medicaid and build a program for qualifying services. Last, costs would be severely limited if medical or parole policies were utilized in order to release inmates who are deemed too sick or too frail to pose a threat to the public. Any deliberate indifference to an inmate's medical needs has been judged a violation of the 8th Amendment according to the 1976 Estelle v. Gamble decision. It is for this very reason that policymakers have had much difficulty determining what healthcare services are held as necessary and which are not. Much like the ACA, correctional healthcare is faced with a constant struggle of controlling costs, ensuring quality, and providing access for all.
There are certain standards set by the National Commission on Correctional Healthcare that show what is supposed to occur and be available for inmates at intake and during their incarceration. A requirement was passed by several courts saying that at intake, prisoners would be screened for communicable diseases or any other condition that would require immediate attention. The NCCHC said that the intake assessment would provide accurate, in-depth medical information, including a treatment plan if needed, to make sure that those with acute and chronic conditions receive high-quality care. This would be achieved by using a horizontal system in order to provide all the services needed. There are 2 options that facilities can choose from for their intake assessment. The first is the full population assessment, which requires initial health assessments for all inmates. The other option is the individual assessment when clinically indicated, which requires assessments only for inmates at a high risk for significant health problems. While incarcerated, inmates have the right to receive care from a credentialed staff member or a specialist. They are also provided with dental care, both emergency and routine. The facility must have accurate medical records on all inmates, and inmates needing medically necessary diets and prescription medications must receive them. Prisoners must be ensured continuity of care from intake to discharge in all areas of care, including mental and dental. When there is an emergency with an inmate, the the facility must have a plan ready to treat them. If outside facilities are not able to handle the emergency promptly and adequately, then there must be adequate staff and facilities within the prison to handle the emergency. If an inmate is taken outside of the prison, then the staff at that prison must review the medical orders and instructions once the inmate returns in order to ensure continuity of care. For mental health care, inmates must have access to trained mental health professionals who can treat them individually. During the treatment process, accurate, confidential, and complete records must be kept. These services are meant to ensure that inmates maintain their highest level of functioning. For those with critical needs, they must receive discharge planning, which includes access to enough medication at their discharge that can last them until they can be seen in the community.
The correctional health system in America has some major weaknesses with few strengths. The biggest weakness is the inefficiency of the correctional system. In an interview with the Washington Post, Dr. Frederick Altus, who has been working with incarcerated patients for 25 years, summed up the inefficiency problem, saying, "When people are released from prison, they are desperate. They are going to find it challenging to obtain employment and to engage various forms of needed care. They do desperate things, and typically they go back and do the same desperate thing that got them in trouble in the first place. Then we provide medical care when they come back to prison, where they have a constitutional right to health care. They have 3 square meals and a place to live, but it's a very inefficient use of our dollars." What stood out in that quote was that people will find it difficult to get needed care after they get out. Why is that the case? Dr. Altus answers that question when he says the minute a patient is incarcerated, he or she is removed from the Medicaid rolls. When that happens, it often takes a long time to get them reestablished. That is not good because after patients are released, they are at risk for losing the gains they made while incarcerated. Patients losing those gains means that when their condition worsens, they will be forced to go back to emergency rooms that are costly to hospitals, or if they go back to jail, the medical staff will be right back where they started. That is why the system is so inefficient. Dr. Altus's proposed solution is not complicated. He says there is no real reason and no extra cost to society to keep that person on Medicaid while they are incarcerated. It really should be continuous. Another weakness of the correctional health system is identifying chronic conditions. Correctional staff are often consumed by emergency suicides, experiencing drug or alcohol intoxication and withdrawal, and people who are dying, as opposed to identifying chronic conditions or re-engaging people in care. That problem could be taken care of by dedicating more people to correctional staff. Psychiatric care is also a problem for the correctional health system. Sadly, in the United States, many inmates do not receive psychiatric treatment at the time of arrest, even those with schizophrenia or bipolar disorder, though after incarceration, access to psychiatric care does improve. The only positive found about the correctional healthcare system is the fact that incarcerated people have the constitutional right to get health care. In conclusion, through a combination of social, economic, and political factors, the correctional healthcare system has evolved into the system it is today. By using the intake system, inmates now have better access to health care than they did in the past. So other than the fact that inmates get care, there is very little positive about the American correctional healthcare system.